doing to have you with us again in 2025. As we get started, it promises to be a very, very interesting show. Call up someone, share the link with someone, make sure you're inviting someone to get this information you're about to get. And yes, we have with us Dr. Kenneth Ikuda. What a good way to start the year with Dr. Ken. Good to have you, Dr. Ken. Yeah. So Dr. Ken will be talking about infection and fertility. For someone watching for the first time, it might interest you to know that Dr. Ken is a consultant gynecologist, is an IVF specialist, he's a minimal access surgeon, a reproductive biologist. I could go on and on. But for the sake of time, we'll just cut it here and just go straight to the business of today. We're talking about infection and fertility. Yeah, so I think this infection it's really a, should I say, a popular issue, both with women, with men, with young girls. Sometimes you hear them saying, my period did not come, so they said it's infection. I took one herbal concussion to wash my system and all of that. So yes, so you see this information you're about to get today is first hand information and world class top notch information. So make sure you're calling someone up right now to get the information you're just about to get. Drop your thoughts, your comments, and your opinions in our comment section. We'll definitely attend to them appropriately. Okay, so that's again today we're talking about infection and fertility. So um well, maybe by way of introduction, maybe you should tell us a little about some of these infections that really have this impact on fertility. What are these infections in general?
It's going to be very difficult when we talk about infections because there are several infections
Mm,
ranging from bacterial infection,
yeah,
fungal infection, viral infection.
yeah.
When virus affect the genitalia of both
Wow,
men and
wow.
female, okay?
Mm,
So we have all kinds of organisms causing infection
mm,
in the genital tract,
yeah.
and by implication, the reproductive organs of infections have done a whole lot of things.
Wow.
People are often, especially women, because the system is open, the vagina is open outward, they are
Yeah.
very prone. And the
So,
surface area uh, at risk of having impact of microbials is
mm,
large,
wow.
and so they are prone to having
Mm,
vaginal infections.
infections.
This
Wow.
is what they call toilet
Infection.
infection.
Yeah.
Sometimes in a consulting room, somebody walks in and say, "Oh,
Mm,
doctor, I think I have a toilet infection."
mm,
Well, in a medical entity, we
yeah.
have nothing called toilet infection, but I think you can make sense of the word toilet infection. That's
Yes.
me now trying to make sense of it.
Mm,
Toilets, lavatory,
yeah.
convenience,
Yes.
and all of those places are places reading with organisms,
Mm,
all kinds of organisms.
yeah.
So women feel when they go to use the place occasionally, and
Mm,
water bounces on them and all of that, an
yeah.
organism that is not befitting can get in contact with their genitalia,
Yes.
you know, and then infection picks up from there. So
Yeah.
that way it makes some sense. And then you
Mm,
see women cleaning up toilets very well, which is a very good habit, just to avoid being infected
infected.
by whatever organism is living in the toilets.
Yeah.
So I guess that's what they call toilet infection. But in any case,
Mm,
it's either going to be a bacteria,
mm,
a fungi,
yeah.
or a virus,
Okay.
or other microorganisms that could inhabit the genital organs of
Regions.
both males
And
and
female
females. So that's what they call toilet infection.
infection. Okay.
Even though in medicine we don't have toilet infection.
Infection. Mm.
Yeah. So you have a very interesting organisms that could affect the genitalia of
Okay.
males and females.
Mm.
Maybe we should start with the common ones.
Okay.
and the most deadly one,
Mm.
which is called chlamydia.
Wow.
You know,
Hmm.
Chlamydia is a bacteria, for instance.
Please make sure you are taking notes.
Chlamydia is a bacteria.
Hmm.
You know, when it infects people, it has its signs. You know,
Okay.
sometimes you have a burning sensation,
Oh,
pain when
wow.
you're urinating.
Hmm.
Occasionally, you have fever.
Wow.
But a very interesting thing about chlamydia, it affects both male and females.
Okay.
A
Hmm.
very interesting thing about chlamydia is this, that occasionally it goes unnoticed.
Wow.
So
Hmm.
you don't even know you have an infection.
Hmm.
But before you realize it, you're trying to conceive and pregnancy is not forthcoming.
Coming.
And
Hmm.
then you go check and the doctors tell you have chlamydia.
Hmm.
Then this chlamydia does a whole lot of things. I guess we're going to talk about it in a bit.
Hmm.
So it affects the vagina. It can ascend from the vagina to the uterus.
Wow.
Then it transports itself from the uterus to
Hmm.
the fallopian tubes.
Wow.
And of course, exudates, which are fluid from the fallopian tubes,
Hmm.
can even deposit in the peritoneal cavity.
Wow.
Peritoneal cavity, pelvic cavity is just inside of your
Hmm.
abdomen, close to the
Okay.
uterus, close to the womb,
Okay.
and cause all kinds of damages around there.
Wow.
So you could have
Hmm.
adhesions,
Hmm.
and all of these can spoil the fallopian tubes, damage
Oh
the
no.
fallopian
Oh
tubes.
no. Hmm.
Now you have the fallopian tubes has what we call cilia. They are hairs,
Okay.
and the work of these hair-like structures is to beat in a direction that they transport eggs from the ovaries
Okay.
to the fallopian tubes, the point
Hmm.
where fertilization happens before
Hmm.
implantation happens. So it
Okay.
damages this cilia. So that
Oh
even when
no.
the fallopian tubes are open,
Hmm.
they are not now the bacteria is they will
Yes.
cause what we call inflammation in medicine, for
Oh
instance.
no.
And that inflammation is like you're having an injury
Okay.
and then it heals, you know, and has other side effects on the fallopian tubes for women, for
Wow.
instance. It can make the fallopian tubes to be blocked
Hmm.
so that it is physically blocked.
Wow.
you know then it can damage the fallopian tubes and make the fallopian tubes accumulate fluids,
Mm-mm.
either one of the fallopian tubes or two fallopian tubes accumulating very toxic fluid,
Hmm.
so that this fluid can flow in either ways, either through the exit of the fallopian tubes at the hand of the fallopian tubes
Hmm.
called the fimbriae close to the ovaries, or it flows back into the uterus.
Uterus. Oh wow.
And if it flows into the uterus, it could come out as discharge. Then if you get trying to get pregnant, for instance, it can become a poison
Wow.
to the primitive pregnancy, I mean
Hmm.
early pregnancy. So
Yeah.
it can physically or mechanically push out the baby
Baby.
or
Hmm.
damage the baby by poisoning the baby, and then you have
Hmm.
an early pregnancy
Loss.
losses,
Hmm.
miscarriage.
Yeah.
So it can also damage the lining of the womb,
Wow. Ah,
you
a
know.
lot.
So this is chlamydia in a woman, for instance. And
Hmm.
that is why most times when a woman is trying to do an IVF, we always try to check whether
Hmm.
there is chlamydia infection or any infection going on, so
Yeah.
that if possible, they are not only treated, but you also find out whether there are signs of complications from these
Hmm.
organisms.
Yeah.
Okay, so that's in a woman, for instance.
Hmm.
So it damages the fallopian tubes,
No.
damage the uterine cavity,
Yeah.
and it can go beyond the fallopian tubes and cause adhesions where the fallopian tubes and the structures in the pelvic of a woman are gummed
Hmm.
together,
Wow.
and so it alters the anatomy.
Hmm.
Sometimes with these infections it spread even to the liver.
Wow.
Yes, you see all kinds of
Hmm.
adhesions connecting the liver to the reproductive organs in a woman, for
Wow.
instance.
Hmm.
And that's, for instance, so you have infections like syphilis. Women have
Hmm.
syphilis.
Hmm.
Syphilis is bacteria too.
Hmm.
So it affects women. So, and that they do the same thing to all, I mean, to all the structures, whether it's
Hmm.
syphilis, whether it's gonorrhea,
Hmm.
Neisseria gonorrhea,
Yeah.
syphilis, chlamydia, and all the bacterial infections
Hmm.
have the same side effects.
Yeah.
Their severity may be different, but the end result may be the same,
Hmm.
because they will block the fallopian tubes, damage the functions of the fallopian tubes,
Hmm.
cause adhesions in the pelvic cavity,
Yeah.
and make pregnancy very difficult for a woman.
Hmm. Wow.
So Those are all the things that these uh, organism causes. Could be
Yes.
virus sometimes, like
Mm.
the papilloma, human papilloma virus.
Yeah.
It's also a sexually transmitted. No, sorry, we've not talked about sexually transmitted
Yeah.
infection, but I'm lumping all the infections together because
Yeah.
whether sexually transmitted infection or the so-called toilet
Toilet.
infection
Mm.
or infection by just sheer contamination of your
Mm.
garments, your clothes,
Mm.
they either fall into category of bacteria, fungi,
Mm.
uh, viruses. You
Mm.
know,
Yeah.
the human papilloma virus, which is common, the common cause of, I mean, the cause of the cervical cancer, for instance,
Mm.
it causes vulvar warts, for instance.
Wow.
You
Mm.
know, condylomata accumulata, all of those
Wow.
funny name in medicine.
Mm.
It causes all these things around the genitalia, so that
Wow.
even when you get pregnant, you deliver a baby, and the baby gets contact with those infections around the
Yeah.
genitalia, the baby can have problems.
Wow.
So that's the way it affects women.
Women.
And
Mm.
infection also affects the quality of the ovaries.
Hmm. Wow.
Yes, severe infections could spread to the ovaries, and when they have spread to the ovaries, for instance, they affect the ovarian reserve. That's the
Wow.
quality and quantity of eggs that a woman have left.
Oh no.
So this is what infection does. It
Hmm.
lowers your potential for pregnancy. It
Yeah.
may make spontaneous pregnancy,
Hmm.
unaided pregnancy to become difficult.
Yeah.
you know and then it can even go beyond that and affect the quality of eggs and the number of eggs you have.
Wow.
And so
So
it
much
makes
impact.
pregnancy difficult. It could block the fallopian
Fallopian
tubes
tube.
and all of
Wow.
that. So,
Hmm.
so those are some of the infections:
Hmm.
the chlamydia infection, the syphilis, the gonorrhea. So they fall into bacteria, fungal, virus, and
Hmm.
all of
Oh.
that. So
Hmm.
they cause all of these problems. And you
Hmm.
know what? This is actually a lot commoner in the tropical countries, in the third world countries, and all
Hmm.
of that, for simple reasons that health seeking behavior, it's very poor, and
Hmm.
poor socio-economic conditions. Yeah, that's how it
Wow.
affects women. You
So
can go on and on and on and
yeah.
extrapolate them.
Mm.
Yeah.
So okay, we've talked a lot about women, and I know you also said it also has an impact on the male.
They didn't hear me talk
What?
about PID, because
Yeah.
every woman that comes to the consulting room, hey, the doctor say I have PID, PID, they
Mm.
all fall under bacterial, fungal, viral infection. Yeah,
Mm.
PID, a lot of time it's bacterial infection.
Mm.
Yeah.
Okay, so you've heard a lot of the impacts of infection on a woman's fertility. So much, like it's even becoming scary.
Mhm.
So it's not something for you to joke with. Once you maybe we'll talk a little about the symptoms so that some people know what
Mhm.
symptoms that they could have that could be a signal that there's infection somewhere and they need to get checked. But maybe we should talk about the impact on the men. Let's make it
That's my
equal.
people, right?
Oh yeah.
Those of us.
Yeah.
The same way it affects the women, affects the male.
Mm,
The man has a penis, and the penis has the urethra, which is the
mm,
outlet through which either sperms comes out of or the urine comes out of.
mm,
So So when the same happens with man, the chlamydia affects the man, the
mm.
syphilis affects the man,
Yeah.
gonorrhea affects the man. Okay,
Mm,
so usually for men, these are the organisms commonly: the bacteria, the gonorrhea, the Neisseria gonorrhea, the
yeah.
syphilis.
Yeah.
And even the human papilloma virus affects men too.
Oh wow.
Yeah, because men transfer it to women, and the
Okay.
effect on men is
Wow.
not so telling, but the
Mm.
women end up having all the vulvar
And all
warts and all
that.
this cancer of the
Mm.
cervix. But
Yeah.
it's a sexually transmitted disease, and
Disease.
usually women get it from their male partners.
Mm.
Often this is
Wow.
one of the ways the transmission is. So
Yeah.
men get infected with this, and for men the symptoms are: you have a discharge from the urethra,
Wow.
your discharge, things that looks like pus,
Hmm.
looking very offensive, have a bad smell.
Hmm.
Then you could have pain.
Wow.
Yes, pain in the test, in the urethra.
Wow.
you know then you could have discharge from the penis.
Hmm.
Then
Wow.
pain on urination.
Wow.
Then extreme cases, you could have rashes on the penis, or
Wow.
sores on the penis.
Hmm.
Then also, and maybe little growth or sores around the genital areas,
Wow.
especially when it is syphilis you're dealing with. Then
Hmm.
rashes often.
Hmm.
you know So those are some sign of the infection. Then of course fever could be there,
Mm.
pain on urination, though it's good to differentiate it from urinary tract infection,
Mm.
but
Yeah.
because the urethra is inflamed, is discharging pus or whatever is discharging, if normal urine should come out of that place, it could be painful. And
Yeah.
this infection could spread down from the tip of the penis to the shaft of the penis
Oh, wow.
to the scrotum,
Hmm.
to the epididymis. Epididymis are the stuff that that store the sperms.
Mm.
You know,
Okay.
yeah, that's the sac where the sperms are. So the epididymis.
Mm.
The rate testes, the testicles, everything can get inflamed, and that is why you
Wow.
start having things like orchitis, where a
Hmm.
man have pain in the testes
Oh,
or in
wow.
the scrotum. Sometimes the
Hmm.
scrotum can get swollen.
Okay.
You know,
Wow.
then for the man, uh if the urethra is involved, for instance, and the infection heals and happens again and it heals, it can make the urethra to be blocked.
Wow. Hmm.
So it's not able to even urinate,
No
and then maybe to bring out sperms becomes a problem.
problem. Wow.
You know, then it could go to the testes, for instance,
Yeah.
and affect the epididymis.
Wow.
So if you have a ultrasound scan for this kind of people, for instance, you
Yeah.
find out you have signs of infection from the
Hmm.
ultrasound scan, where the radiologist will make diagnosis of stuff like chronic inflammation,
Okay.
microlithiasis, and all of
Okay.
that,
Oh, wow.
all because infection has spread. Okay,
Hmm.
sometimes trauma can cause all of those
Okay.
things to happen that
Hmm.
way, but
Hmm.
infections also cause them.
Okay.
The most interesting part, or the most the main complication, is
Yes.
if, just as women have fallopian tubes,
Yeah.
men have the vast difference. So the
Okay.
vast difference is like the equivalent of the fallopian tube
Okay.
in a woman,
Yeah.
for
Mm.
a man,
Mm.
because those are the conduits that transfer sperms from the
Okay.
epididymis
Oh, wow.
to the penis,
Okay.
urethra, and out of
Oh,
the
wow.
penis during
Okay.
intercourse or
Yes.
ejaculation and all
Mm.
of that.
Mm.
So, and these are very tiny tubes,
Wow.
maybe like the bore of a pen, or
Okay.
thinner actually than the bore of a pen.
Wow.
So the fallopian tube may be 3 to 4 times the
Hmm.
diameter of the vast difference. Okay,
Okay.
so the vast difference easily get blocked from
Hmm.
infection and inflammation.
Oh,
That
wow.
way, the man is producing sperms,
Yeah,
but the
but
sperms cannot be ejaculated because the
yeah.
conduits are blocked.
Wow.
The conduit is blocked, and now you can even get worse than that.
Hmm.
Infection spreading to the epididymis, for instance,
Okay.
and that's where the sperms are stored. You damage
Sword.
where the sperms are stored. Where did the sperm get stored? So
Hmm.
it affects the process of sperm development. And
Okay.
so
Oh,
these days,
wow.
you have a lot of men having infertility because of sperms.
Hmm.
It's either the sperms are already damaged by infection, or the process of production has been affected
Oh,
because
wow.
some of the organelles have been affected by infections.
Yeah.
You
Hmm.
know, so that's how it affects men. So that way, there's problem with ejaculation of sperms. So this kind of
Yeah.
man wants to get pregnant, for
Hmm.
instance, he has to go to see IVF specialists like us,
Yeah.
where
Hmm.
we have to cut to his testes
Wow.
and surgically extract sperms
Hmm.
and make his wife pregnant. You
Yeah.
understand?
Hmm.
So infection causes all of that.
Ah, so much for
Then
infection.
infection can affect the production of sperm negatively.
Wow.
You know,
Hmm.
cause a reduction in the quantity and the volume of sperms. And for some
Wow.
people, it can make them totally not having sperms.
Oh no.
Yes, there are other reasons why people may not have good sperms. When you have diabetes, for instance, it
Hmm.
affects your sperm. When you have problem with the thyroid hormones, sperms could be affected. If you have problem with the part of the brain, the pituitary, the
Hmm.
hypothalamus, sperms production can be affected. Then,
Wow.
of course, if you have a genetic predisposition not to have good sperms,
Hmm.
because of problems with the Y chromosomes, you could have problems with sperm production. But
Wow.
infection does worse
Hmm.
than all of this, affect more people
Wow.
than these other ones that I've mentioned.
Wow.
So 40% of couples having infertility are because
Yeah.
of sperms. So you can see that burden very
Yes,
big.
the,
It's a
exactly.
very
The
huge
burden is
burden. So
really
then
huge.
you could have sperms now after infection, but the sperms are not in good number
Hmm.
or in good structure or morphology to make a woman
Yeah.
pregnant.
Yeah.
So you still need to be aided to get
Hmm.
pregnant. So
Very, very.
infections should be taken very seriously,
Honestly.
very, very seriously.
Wow.
Yeah.
This is a lot, and like coming from a gynecologist, coming from a very skilled gynecologist at that.
Yeah, you can say that again.
Yeah. you know so coming from him, then you can imagine what people have to deal with infection. And I think it's really popular a lot. People, some of these, some even teenagers suffer from these things.
Yes, innocently they suffer from it.
Yeah.
Innocently. You
Hmm.
have young girls go to school, innocent girls, but
Yes.
and they get exposed to infection,
Oh,
not
no.
because somebody assaults them, but
Yeah.
because of sanitary abnormalities.
Yes.
You know, it doesn't matter whether it's infection from sexual
Oh no,
intercourse or
exactly.
or, or sexual assault. Infection is infection and should be dealt
Yes.
with. Their restrooms in the schools are not
Hmm.
well kept, and some
Yeah.
people have this thing from childhood,
Oh, it's just, oh no.
from young adult
Yeah,
stage, and
yeah.
they take it to, and it affects their reproductive life.
Yeah. So
So
there's just so much about infection that we cannot. Okay, yeah, I was saying that you tell us a little about the symptoms for women, what they can possibly see that they, okay, this is a signal that there might be infection somewhere. You need to see a doctor and get treated and not allow it to escalate.
oh yeah, so
Mm.
even though I mentioned a little bit of
Yeah,
it,
yeah, you did.
the common things that women present when they have infections is
Mm.
a vaginal discharge.
Okay. Mm.
And now this discharge is not the usual healthy discharge that they have.
Mm.
This will be offensive,
Mm.
it may be copious. I
Mm.
mean,
Plenty.
it may be plenty.
Mm.
Then it could come with the colors will be altered. Could be, and every discharge is special colors are for special infections.
Mm.
It
Wow.
could be creamy, it could be
Mm.
cheesy, it could be
Mm.
brownish, it could be
Wow.
all sorts, it could be greenish, and each
Ooh,
of these
wow.
colors
Mm.
are associated with particular kind of
Organisms.
organisms.
Mm.
So uh, that is the common thing they present with discharge.
Mm.
Then itching
Okay. Oh,
down
wow.
there,
Mm.
and occasionally rashes.
Okay.
You know,
Mm.
then there could be pain in the
Okay.
lower abdomen.
Mm.
Pain in
Okay.
the lower abdomen. Then especially when they're having PI, the pelvic inflammatory
Okay.
disease is pain in the
Disease.
lower abdomen.
Mm.
Then you could have a fever.
Oh, wow.
Yes, very high
Mm.
fever sometimes.
Mm.
Sometimes they could vomit,
Oh,
all
wow.
because of
That's,
infections,
yeah.
you
Mm.
know. So those are some of the features. And the smell, each infection has its own characteristic smell
Smell.
too.
Mm.
Some smell like fish,
Mm.
some smell like some other things,
Mm.
So
They might
well,
have
the
this foul
specialists,
smell.
use that to make a diagnosis, of
Mm.
course, doing the necessary laboratory
Oh,
investigations.
no.
So if a woman has this, it's an indication that she needs to go to the hospital to
Mm.
see not just anybody,
Yeah.
see the custodian of the female reproductive
Reproductive
system,
system.
which is us,
Yeah.
not the
Eh.
cardiologist. You
Yeah.
see the gynecologist,
Mm.
you see the
Mm.
die-hard
Yeah.
gynecologist. So let's make a diagnosis and treat with the aid
Yeah.
of laboratory and pharmaceutical interventions.
Mm.
But what we notice in African sub-region, is that once women have these infections, they're shy. They're shy. A good number of them are shy,
Mm.
that they think they are maybe promiscuous or something.
Mm.
It's not about
Oh.
promiscuity. It's about your health.
Yeah. Yeah.
Seek help the right place. Some of them sneak to get medication
Over the
from the
counter.
medicine store, patent medicine
Mm.
store, without seeing healthcare professionals.
And the real
And
cause
so they
organism.
get different drugs. I
Mm.
mean, drugs that are not befitting for their
For the
condition.
organism.
You don't see somebody who has a knowledge of the abnormality,
Mm.
who has knowledge of the kind of discharge and the
Yeah.
symptomatology of your condition.
Mm.
So what do you
Mm.
end up with? Poor treatment. And
Yeah.
when you have poor treatment, it goes on and on, cycle of
Mm.
repetition,
Yes.
infection, out, in and out of infection, and
Mm-hmm.
before you know it, all the reproductive organs will have been badly damaged. And of course, yeah, sometimes you say, "Madam, your tubes are blocked." Say, why are they blocked? I'm a good girl. I've
Oh,
heard
yeah.
that countless number of times. Life is not about being good.
That's again.
It's not about being good. But that's true, Ruth. It's not about being good.
Mm.
They say I'm a good girl. You say, well, for those who are religious, for instance, they say, no, I've kept myself. It's not about keeping
Mm.
yourself, it's about doing the right things. You know,
Mm.
see the doctor is one of the good things you need to do. very
Yeah.
good things you need to do. So see the right people.
Yeah.
Because if you're a good girl, immoral, I mean, an upright, moralist, and all of that, and you don't take care of your hygiene, you
Mm.
end up with a bad thing.
Yeah.
Why are you laughing? I see this all the time. I
Yeah.
have to do IVF because people have infections that are poorly treated and has damaged their reproductive
Yeah, I
organs.
can imagine.
Do you know how much it costs to do an IVF? You're
Oh
talking
wow.
about $10,000, $15,000, just
Hmm.
because of poor hygiene or lack of good attention for medical
Yeah,
care.
exactly.
So we should talk about it in the gravity it deserves.
Hmm.
So they go to the patent medicine store,
Hmm.
and for instance, you get ampiclox for candidiasis.
Oh my
So what do you
goodness.
expect?
Oh no.
The infection keeps coming, or you take
Yeah.
the right drugs, but not the right dosage
Hmm.
and the right duration. So what do you
Yeah.
expect? You keep making this organism resistant to this medication.
True.
And so you might spread the infection and you
Hmm.
affect a lot of other people with
People,
it. And the cycle
exactly.
of infection keeps going without being
Going.
broken.
Hmm.
So that's it. So
Yeah.
we have to have a good health seeking behavior. It doesn't matter how you feel, what you think. Nobody thinks about you as a bad person.
Hmm.
See the doctor. We know how all these infections happen. Then there are good girls that have these bad infections. Why do I mean good girls? Clean girls, for instance. When we're coming to the boys, I'm a guy, you know,
Yeah.
I'm a genetic male.
Hmm.
I'm a man.
Yeah.
I'm sure I'm Donald Trump's friend. All right, so
Hmm.
they are hyper hygienic.
Yeah.
Yes,
Hmm.
that's a syndrome.
Hmm.
Obsession with cleanliness. They use all kinds of solutions to clean it down there.
Hmm.
So when you use all kinds of solution cleaning down there, you know, you alter the physiological constituents of the
That
vagina.
place. Wow.
So you dislocate,
Hmm.
translocate, and
Oh.
transport the flora
Okay.
to some other places that they are not meant to be.
Oh, I
And
see.
so when the spread of the bacteria, normal bacteria in the
Yes.
vagina is not there anymore, you are exposed to infections. So things
Hmm.
that shouldn't cause infection to
It
you cause
just.
infection. So you don't
Oh.
need to be a bad girl in this case.
Hmm.
But because you clean with unhealthy substances, you
Hmm.
expose yourself to having
All forms of
infections. And
infection.
infection is infection.
Yeah.
It
Hmm.
doesn't discriminate. Once you do
Yeah.
the wrong
Hmm.
thing,
Hmm.
it comes, and
True.
then you can suffer from it. So good girls may have bad reproductive potentials
Hmm.
because of infections. So that's just it. So they need to seek good health. I mean, have good health seeking behavior
Hmm.
and do the right thing.
So you see, there's just a lot about infection and fertility, and he has mentioned a lot of habits that people maintain. Stop going to do self-medication. Once you have these symptoms he has mentioned, please see
Wait,
a
wait, wait,
good.
wait, wait. Some women put powder down there.
Wow.
Yes, powder.
Wow.
For those of us, I remember doing a residency in
Mm.
gynecology. One of the cause of cervical cancer is use of talc powder.
Oh wow.
Yes, talc powder.
Hmm.
You know, and we always mention that.
Wow.
I always remember that some traditional mothers, for instance,
Yeah.
put powders
For their
on their babies'
babies.
nappies,
Yeah.
and tie it
Oh.
around their perineum,
Yeah.
and this attack,
Hmm.
and before you know it, it costs something
For those
because of
children.
poor health practices.
Mm.
I know they think that powders are fine, but
Mm.
that's just what it is. Use powder and all kinds of
Of
things.
salt. Oh, so you see, there's just a lot about infection and fertility. That's why we're bringing this right here to you. That you need to take care of yourself, regardless of how small or how minute the symptom might be. Once you have a little symptom, please make sure you go see your gynecologist, and not just a very good one at that, like Dr. Ken. Yeah. So a very good one at that. So they are able to treat you appropriately, because you could just be taking the wrong medication and treating the wrong thing, and then it suppresses it and it comes back again. So you can't afford to play with your fertility life when you're just getting started. That's for the young ones. And then For those that are old, just whenever you have the symptom, whether you're finished giving birth to the number of children you want, infection is not good for
No
anybody.
good.
So
But
you should.
you know the men are actually more secretive. Let's
Mm,
talk about us now.
okay,
The men
yeah.
are a lot more secretive. Women are
Mm,
actually better at health
mm,
seeking behaviors than men. A
wow.
man may have gonorrhea, for instance, or syphilis, and he
Mm,
keeps it secret.
to himself. Oh no.
He may not he may be so bold as not to seek for medical help,
Mm,
thinking that this will just go.
mm,
A good number of them seek for help or secretly. And when you do that secretly, you don't get good help because you're likely meeting the wrong person for help. And
yeah.
so you have gonorrhea, syphilis, all kinds of infection.
No.
They just escalate, ascend to wherever they ascend and cause all kinds of damages. So men should seek help. It's not about being macho.
Yeah.
Bacteria doesn't respect
Gender.
your masculinity. It
Mm,
doesn't respect gender. It affects
mm,
everybody, and you must
yeah.
give it the care, the attention it deserves.
Yeah.
Otherwise, things wouldn't turn right. So
Yeah.
we could save our fertility. We could make our life easy, fertility life easy,
Yeah.
and more prospective by dealing with these very quote unquote minor infection or severe infections. Yeah.
Okay, so as we wrap up, what's your counsel to someone watching with regards infection and how they should take care of themselves?
Oh well, a woman knows when she's normal. A guy knows when he's normal too.
Mm,
So infections have symptoms, but the painful thing is that some of these infections do not come with symptoms. They
mm,
can just come quietly. They glide through
mm,
quietly and
yeah.
leave a trail of wreckages. As
Wow.
they go.
Mm,
Chlamydia is one very important one affecting
mm,
men and female. And good thing chlamydia is so easy to treat.
oh, wow.
In fact, it ranks among the easiest uh, genital tract infections to be
Mm,
treated,
mm,
chlamydia. But then it's the most destructive of these infections.
yeah.
So have good health seeking behavior. Understand your body, understand the symptoms, seek for help. It doesn't
Mm,
even matter if you go seeking for help where there is no infection and
yeah.
let the healthcare professional say there is nothing to worry about here, then
Yeah.
you go and have good time with yourself. Okay,
Mm,
as against having this infection, having the
and just staying
symptoms, and
back.
just keeping it all to yourself.
Mm,
A stitch in time, they say, save nine.
yeah.
So if we pay attention to our reproductive organs, our genital organs, and infections have symptoms, and we attack the symptoms as aggressive as possible, under the right circumstances,
Mm,
seeking the right health care, I think we're going to be fine. We're going to do a lot saving our reproduction now and for the future. The most painful is when it's affecting kids. Their
mm,
parents need to be responsible.
yeah.
Yeah, need to be responsible.
Okay, so
I would like to talk about this. I live at the moment, I'm in Nigeria. I live in Jos, Nigeria. And kids, for instance, have a lot of viral infections.
mm,
A lot of viral infections.
yeah.
Mumps or is one of those viral infections.
Wow.
It's not a sexually transmitted infection, it's just virus. And there are a lot of other viruses. When we start investigating, you find out there are a lot of viruses. Some of these
Mm,
viruses affect the testicles of young kids.
wow.
Yes,
Oh
especially
no.
mumps does that,
Hmm.
affect the testicles of young kids.
Hmm.
So I'm saying this because parents shouldn't always think their babies have malaria.
Hmm.
Some of these infections are viral
Mm,
illnesses. And because we're not
yes.
so equipped with sound laboratory advancement to make quick diagnosis of virus, we treat all kinds of things in the name of
Yeah.
bacterial or malarial infections, and
Sure.
not knowing that we're dealing with virus. And that's why you see
Yeah.
these fevers continue for a very long time before they
Hmm.
abate when the virus
Yeah.
has completed its
The
cycle.
cycle.
You
Oh no.
understand? So I think kids should be cared for, should be treated when they have this fever
Hmm.
aggressively.
Yeah.
And if we can minimize the rate of viral infection for kids, it's going to be fine because a lot of these viruses are not coming for any other thing but for the testicles of babies.
Hmm.
And
Wow.
then you can now grow babies without sperms.
Mhm. Wow. Oh no.
Yeah, yeah, this is very serious.
Wow. So you
You
see,
know,
this is a major one that you just mentioned, because I know growing up I've seen a lot of children that have this swollen.
mumps,
Yeah,
and when you have the mumps
exactly.
here, it
Mm.
has a predilection for the testicles.
Wow. Who can
You know, that's
imagine?
a virus.
Yeah, and
Mhm.
you're like, wonder the relation. Oh no.
So that's it. So that's
Yeah.
also infection, and this one just grinds the male child.
Oh my
It just
goodness.
grounds him
Mm.
reproductively. You know,
Wow.
you have no good
So that's why
stories.
it's good you seek attention early and don't
Mm.
just presume and leave everything to chance. Yeah. So with your with you, yeah. So with your experience, I was just thinking, sometimes couple, one person might be silently treating infection, and then but then you have a partner and the partner is not treating, and then you keep wondering what's happening. Why do you keep having these infections coming up when you're trying your best to keep yourself and make sure you're treating yourself? So what's your counsel with your experience? Should both partners always treat together? Or yeah, when when one person is having the same infection coming up over and over again?
Yeah, yeah, we have to look at the practices that these
Mm,
partners are involved in, you know,
mm,
and by practice I mean maybe health practice or hyper hygiene practice,
mm,
you know, and of course sexual practices. You know,
mm.
they should be decent and be open to themselves. That's the much I can say. But of course, when you find out the one that is doing wrong, just beat the person up.
Because
Beat the
sometimes,
person up,
because
and then if they're seeing a gynecologist, please treat them both.
yeah,
Treat them both.
so it's good that
Otherwise,
both of them.
if they care for themselves
Mm,
and they love themselves and they have a common future to share,
yeah,
it's I think it's inhuman to keep this kind of information
yeah,
hidden from the partner. It's
true.
inhuman. It shouldn't be done.
Mm,
And if anybody is doing that, I think you should stop that. There's nothing as good as being open. Hey, I
mm,
have this, I'm treating it. Can we treat it together?
together.
Simple as
Mm,
that.
yeah,
And not looking for the blaming game thing, you know, yeah,
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 mm,
and all of that. So they should treat it together. They should be open to themselves,
mm,
you know, and discuss this openly, and they see the doctor together.
yeah. So we've given you all food for thoughts. Think on these things, like
And beat yourself
yeah.
up.
Oh yeah. Oh yeah. So I know you all had a good time today, and I know you've had a lot. You've learned a lot about infection and fertility, and nobody is too small to treat infection, regardless of your age. So we leave you to go back and take care of yourself appropriately as required. It's been amazing having you with us, Dr. Ken, today, and thank you, dear viewers, for staying tuned with us. Have a lovely evening till we come your way next time. Bye.